Hi everybody, we're going to pick back up in your course pack on page 56 and discuss some short-term and hormonal regulations of blood pressure. Well, we've spent some time talking about neural control. We've talked about baroreceptors and chemoreceptors and their method for controlling blood pressure through feedback with the vasomotor center and the cardiac center in the brain. So we've checked off that, and now we're going to talk about chemical control. On the top of page 56, you'll notice there's three chemicals that we're going to discuss that play a role in regulating blood pressure. Histamine, a potent vasodilator, nitrous oxide, also a vasodilator, and nicotine, a vasoconstrictor. So you may recall learning about blood cells in a previous chapter, and one of those specific types of blood cells released a chemical called histamine. You may have heard of the basophils. They're the ones that release histamine. And this is a way to respond to inflammation. It's part of the inflammatory response. Now, basophils happen to be the least common of our blood cells. In fact, they're the least common of our white blood cells, and that makes them the least common of all blood cell types. But wow, these cells pack a punch because histamine has quite an effect on the body's blood vessels. Blood vessels dilate, they become leaky. That allows for healing agents to travel through the vessels to the tissues where damage may have been done. So if you have a histamine reaction, maybe perhaps in response to an itchy bug bite, you've experienced how histamine can cause redness, swelling, heat, and pain around a bug bite. If you happen to have hives from an allergic reaction, that's also a histamine response. We take drugs like Benadryl, which are antihistamines, in order to block the effects of histamine, which of course is produced by those basophils. So histamine is a potent vasodilator. That means that vessels relax in response to histamine's presence. Now, what impact will that have on blood pressure? Vasodilation promotes a decrease in blood pressure. Nitrous oxide is also produced naturally by your blood vessels, and it's the blood vessel's response to high blood pressure. So if you have high blood pressure, your vessel relaxes due to its own production of nitrous oxide. Nitrous oxide is also NO. And that's kind of an interesting thing, because if you are huffing one of these bottles down below, then you are inhaling levels of nitrous oxide that are unregulated. The problem with that is it can cause a drastic drop in your blood pressure to the point that you become hypoxic. That means not enough oxygen would be reaching the brain. In laughing gas, which is nitrous oxide, we receive a regulated amount of nitrous oxide. People wear a pulse oximeter on the finger to measure that there's enough oxygen still reaching those extremities. If the pulse oximeter shows less than, say, 90%, then we may want to look at regulating or changing the level of that laughing gas. So if you ever get to wear laughing gas and have a pulse oximeter on your finger, you'll notice it gives you a little bit of amnesia. You probably don't remember too much about the event that you were wearing that laughing gas for, which is probably a dental event. And of course, you know, that relaxes you into not being stressed out and uptight about the procedure that's being done. Nicotine is another chemical that is found in cigarettes, and this particular chemical is certainly not produced by the body, but it is a potent vasoconstrictor. Since it's a vasoconstrictor, what impact will it have on blood pressure? It increases blood pressure. So something to think about, that cigarettes increase blood pressure due to the presence of nicotine. All right, so first off, we've checked off neural control of blood pressure regulation. That's the role of baroreceptors, chemoreceptors, and the medulla oblongata's cardiovascular center. We just discussed three types of chemicals that play a role in blood pressure, and now we're going to talk about some hormones. Way back in our endocrine studies, we did talk about these hormones. In fact, epinephrine and norepinephrine, the first ones listed there, cause cardiac output to increase. They also cause vasoconstriction of our vessels, and they also increase blood pressure. Just a note there that beta blockers block the effects of epinephrine and norepinephrine on the heart, and in turn that will lower the heart rate, and by an indirect measure it will also lower the blood pressure. So beta blockers are drugs that block the effects of epinephrine and norepinephrine. The next hormone is ADH, or antidiuretic hormone. This particular one is also called vasopressin. That's a great word there because vaso implies vessel. Pressin means to squeeze or constrict. Now, not only does this particular hormone cause us to retain water, it also makes our vessels constrict. Both water retention and constricted vessels will increase our blood pressure. All right, so you'll notice on your worksheet there's a question there that says, why do you think a patient might receive vasopressin rather than epinephrine as a way to increase blood pressure? Well, epinephrine and norepinephrine increase heart rate and blood pressure. ADH only increases blood pressure. If heart rate increases with ADH, it's through an indirect reaction to the increased blood pressure. So perhaps you have somebody who doesn't need heart rate increased. That's where vasopressin can raise the pressure without directly increasing the heart rate as well. Okay, so you may need to replay that sentence in order to jot down your answer. ADH increases blood pressure without directly increasing heart rate. So that's why this particular drug may be a better choice for someone who has heart problems and doesn't need their heart rate increased. Angiotensin II is also a potent vasoconstrictor. It increases blood pressure, and it also stimulates the release of aldosterone. You may recall that aldosterone promotes water and sodium retention. Of course, that's a little complicated there that we won't go into right now, but we know that angiotensin works by activating the release of aldosterone. You may also notice on your worksheet a little bit about ACE inhibitors. That's spelled ACE inhibitors. That particular enzyme or drug is to block the converting enzyme that produces angiotensin II. So the goal of these inhibitor drugs is to lower blood pressure and block angiotensin II. So you may have heard of drugs like ramipril and lisinopril. Those fall into a category of drugs called ACE inhibitors. Finally on our list is the only one here who lowers blood pressure, and that's atrial natriuretic peptide hormone, or ANP for short. This particular hormone has a lot of great hidden clues. Atrial reminds us of the heart. Natri is the portion of sodium, and uretic means to urinate or produce urine. Peptide tells us it's a protein-based hormone. So this particular hormone is produced by the atria of the heart in response to high pressure in the heart, and in turn the person will urinate out extra fluids, fat loads, and sodium loads from the bloodstream into the urine. So this particular hormone works as an antagonist to aldosterone, meaning it lowers blood pressure, whereas aldosterone increases blood pressure. Okay, so I'm hoping this page here is a great review for you. All these hormones have been covered in our endocrine system chapter. Now, if you have your course pack handy, take a look at page 57. There's a set of practice problems there for you to work on. There are answers posted to this in your Learning Management System D2L.